Welcome once again to another edition of Good Books Radio. I'm your host this week, Dr. John Cook, and we are fortunate to have with us two authors of a very important book. Nancy Altman and Eric Kingston founded the not-for-profit organization Social Security Works in 2010, and they co-chair the Strengthened Social Security Coalition, comprised of more than 320 of the nation's leading national and state seniors union. Both served on staff to the 1982 National Commission on Social Security Reform, a bipartisan commission that forged the consensus leading to the enactment of the 1983 amendments to the Social Security Act. On the organizing committee of the National Academy of Social Insurance in the mid-1980s, they later served on the Academy's founding board of directors. Both also served in 2008 on the advisory committee to President Barack Obama's Social Security Administration transition team. Nancy Altman is a lawyer and author of The Battle for Social Security, a member of the faculty of Harvard University's Kennedy School of Government from 83 to 89, and she taught courses in private pensions and Social Security at Harvard Law School. She's currently on the board of the National Academy of Social Insurance, and she chairs the board of directors of the Pension Rights Center and lives in Bethesda, Maryland. Professor Eric Kingston is Syracuse University's social work and writes about politics and the economics of aging. He's the director of emerging issues in the aging program of the Gerontological Society of America from 84 to 85, and he also served as senior advisor in 1994 to the Bipartisan Commission on Entitlement and Tax Reform. He's the author of Lessons from Joan, Living and Loving with Cancer, and he lives in New York. So we have two authors with distinguished vitas. Nancy and Eric, welcome to the program.
Thank you so much for having us.
This is a great book. The book is called Social Security Works, Why Social Security Isn't Going Broke and How Expanding It Will Help Us All. It examines the data carefully and discusses both the problems and the solutions that it faces. Let's start with the most important thing, and that's countering the big lie that Social Security is going broke.
Social Security is extremely conservatively financed. It can only pay benefits that has sufficient income to cover the costs. And to make sure that it always has that sufficient income, every year the Board of Trustees, who are in control of the money, project out 75 years, 3/4 of a century. Now, whenever you project out that far, sometimes you're going to find, a surplus, a deficit, and you got to take care of that. But the important point to understand is that we are the wealthiest country in the world. We can clearly afford Social Security's very modest benefits, and as we explain in our book, we can and should increase those benefits, and we can definitely afford increased benefits. As a society, we are very wealthy.
And this is important to the economy as well as society as a whole. But before we leave this point about the misinformation and the half-truths, you discussed the fact that there's this well-financed campaign that's looking to dismantle Social Security and has been successful in undermining our confidence. And the media has uncritically broadcast some of these misconceptions and ignoring the facts.
Absolutely. And for many years, there have been people, from its beginning, there have been people who have been opposed to Social Security, strongly opposed. But beginning in the 1980s, the discussion took a new turn. The opposition to Social Security was funded by billionaires who are absolutely interested in turning the debate around. At first, they've thrown everything they can at it. It's like spaghetti on the wall. It's unfair to men, it's unfair to women, it's unfair to rich, it's unfair to poor. That attack didn't work, so they tried a new one. It's not going to be there. We want to privatize it. Let's put it in the bank. Well, that didn't work very well. The American people understood that they were going to lose hugely if the system was privatized, and the near collapse of our economy in 2007 has driven that home. So then there was a new attack, which is, this is a wonderful system. We just want to modernize it, meaning we want to radically pull the pieces of it apart. The system, the new approach has been to insinuate that Social Security is a cause of the federal debt, the federal deficit, and the facts remain that Social Security cannot borrow a penny. It is, as Nancy just said, conservatively financed. So, but years and years of advocacy have softened up, have undercut the American people's confidence in the system, and in doing so, it has robbed the American people of a core benefit of Social Security. That benefit is providing a sense of security, that In the event of your death, there will be resources there for your children. In the event of your disability, those resources will be there. And when you retire, there'll be core protection. In fact, that core protection is there. There's nothing more secure for Social Security. It's also why, in Texas, every month, nearly 4 million Texans receive benefits. 1 in 7 residents receive benefits. Over $50 billion flows into the Texas economy from Social Security each year. Mm-hmm. So it's a core system. It's fully and well financed, and it's an institution we count on as a people.
And interestingly, this is like a lot of political issues these days, thanks to Citizens United in part at least, that well-financed campaigns may not reflect the population at large. And this is an issue that Americans are overwhelmingly united on. They support Social Security, and that's true of Republicans and Independents and Democrats and Tea Partiers and union households and progressives. Everybody supports this by large majorities.
Absolutely. This is a program that, starting back in the 1930s, has been very heavily polled. Conservatives poll it, liberals poll it, everyone polls it, and the results are exactly what you say. 80% of the American people say it's more important than ever, that benefits should be expanded, it shouldn't be cut. They understand the importance of it. In fact, one pollster has called it not just a preference, but a core value. And as Eric said, what this campaign has tried to do is undermine confidence in the program and also engage in a divide and conquer strategy, so that they've said children are being unfairly treated because seniors are getting too much money. And now a new attack, which we foreshadow in our book, and we weren't expecting it to happen the very first day of Congress, but it is already there, and that is an attempt to make seniors the victims and say that disabled people on the disability rolls are all frauds and they're taking money away from seniors. It's this kind of divide and conquer that is against the basic values that underlie Social Security. Part of the strength of that program and why it is so widely supported is it represents basic American values. The harder you work, the more you get. All of us in it together, caring for ourselves, responsibility for others, sharing risks and sharing the benefits.
Mm-hmm. And I think that's one of the important points that you make in the book, is that, this really isn't a savings plan. This is social insurance. And I think when they talk about privatizing this, they miss the boat altogether on that issue.
You're so right. Absolutely right. One of Nancy's favorite analogies is if you own a home, you buy a home, you're paying your mortgage. You don't run out and start trying to save for your house burning down. You buy insurance. Same thing with wage insurance, Social Security. We can't do it through savings. Of course, savings is good. We all ought to save if we can. But the vehicle that protects the American people is Social Security, and it's time for us to build upon that. We now know that, and we talk about this in Social Security Works, the book. We now know that roughly 2/3 of working Americans are heading towards a retirement where they'll be unable to maintain their standard of living. The systems that we have in place for savings in retirement, other than Social Security, have not worked very well. Home equity has been diminished either because people borrow from it to pay loans, to pay for their kids' colleges sometimes, or just to live. Many Americans are carrying student debt or other debt. Americans have seen that their wages haven't increased much over the last 30 years. Health insurance costs have gone up. Even if we assume Americans work all until age 65, 2/3 are facing a meager retirement. That is a crisis, and the one vehicle out there that can really make a dent in this crisis is an increase in Social Security benefits, a variety of increases, and as Nancy just put it, it's fully affordable.
Mm-hmm. I do want to get to that too, but I want to go back to a minute in history for when this came about, because a lot of people in the industrial age were dependent on wage income and worker comp for accidents and health insurance and things like that. And Freedom to unionize was part of what made our middle class strong. But when the Great Depression occurred, the wisdom of FDR and Francis Perkins was we need this safety net, especially for the older workers who were particularly vulnerable. And before that, they went to the poorhouse. Now, I can remember as a kid joking around about going to the poorhouse, but I never knew what it was. It's indentured servitude, basically, isn't it?
Yes, you're exactly right. When Social Security was enacted, every state but New Mexico had poorhouses, and they were tended to be inhabited not by young poor, but by people who had been independent wage earners but had gotten old, didn't have children who could take care of them, and wound up literally going to the poorhouse. When in the 19th century, when people lived on farms, you could age, and there was an extended family, but with industrialization and urbanization, as you say, people moved into cities. They were often far away from family, and they were dependent on wages. So even though Social Security was enacted during the Depression, it was not created for the Depression. It was created as a foundation, a wage insurance, a protection in good times and in bad. And in fact, Social Security has worked wonderfully in good times and bad, during wartime, during this recent Great Recession, during 9/11. Those benefits continued to be paid. In fact, the victims of 9/11, those children who lost parents, received survivor benefits from Social Security. It was the most important insurance that people got at that time.
Mm-hmm. And that act in 1935, passed under a lot of opposition, really created two things: the unemployment insurance, old age insurance, and also aid for dependent children and aid to the blind was part of that, wasn't it?
Yes, and actually it created a number of things. It created wage insurance programs like what we call Social Security today and unemployment insurance. It also created, as you said, aid to dependent children, but also old age assistance and aid to the blind, welfare-related public assistance programs. And it also created a number of vocational rehab and social services and public health-related services. So it was a foundation. The idea from the very beginning is that this would be something that would be built upon by future generations of workers.
Mm-hmm. And from the 30s to the mid-70s, they arranged to keep it working for more and more people.
That's correct. President Roosevelt, in his signing statement, called it, as Eric just said, a cornerstone. It was by no means finished. It was a beginning on which to build, and every generation has built upon it. So in 1930, just a few years after it was enacted in 1935 and 1939, survivors' benefits were added for widows and children and widowers. And then in 1956, disability benefits were added. In 1965, Medicare and Medicaid were added. In 1972, there were annual automatic adjustments to benefits. You didn't have to wait for Congress to act. And now what we say in our book and what we believe is it's our turn. Now it's this generation's turn to pay it forward and to improve this program, build upon it, build upon the strong foundation for all the generations that come after us.
Mm-hmm. And then things took a turn against any kind of government solutions when Reagan was elected in 80. I still remember his speech, his inaugural speech, where he said the words you dread hearing are, "I'm from the government, I'm here to help you." But he also vilified government, suggesting that it was the problem rather than the solution.
And I think that strain of critique has been there all along, beginning with 1935. President Roosevelt, in the election of 36, President Roosevelt's opposition, Alf Landon, was referring to Social Security as a fraud on the working man.
I think he said a cruel hoax at one point.
Yes, he did.
In the vernacular of the time.
Same speech.
Mm-hmm. And that goes forward. But by the mid-1950s, it was pretty well accepted. General Eisenhower, our president then, President Eisenhower, refers to Social Security as core foundation of society, and he says there's a small group of people like H.L. Hunt, the oil man in Texas, sorry folks, mm-hmm. but who are opposed to it. But as he put it, said they are stupid. in the same letter that he writes to his brother. No party should be against it, basically. Then in the 70s, we start having some financing adjustments that we anticipated, and we start making them, and some that we didn't anticipate. But that debate changes, and we have landmark legislation in 1982. But following that, as we said, there's this new attack. Nancy and I are both so-called baby boomers. I'm a little older than her. I'm 68. So we heard back then that those seniors are robbing baby boomers of their retirement. So we have this new attack of old versus young. Well, today you hear the same attack from the same folks. Those seniors are robbing people, are robbing children. This divide and conquer strategy doesn't work. We're all in this together. We see this as a vehicle for advancing the well-being of families. We are the only nation, as actually President Obama pointed out the other day, the only nation that doesn't provide some kind of payment to individuals giving care to a newly born or adopted child or sick family members. It's long past time that we provide paid leave for American people to support caregiving. It's one thing to say we support the family. We also have to especially support families when they're under that kind of stress. We can afford it. It's long past time that we give many people receiving benefits today a real increase in benefit, not a 1.7 short cost of living adjustment, which we gave last year and the year before, but a real opportunity to partake in the growth of the economy, partake fully in our economy.
Mm-hmm. Now, as the 21st century begins, we get George W. Bush, who resurrected some of Alf Landon's stuff and asserted that Social Security's reserves were nothing more than IOUs, and that charge is not true, as y'all point out in the book. But a lot of prominent politicians begin to blast it, especially when you combine it with Medicare and Medicaid. So now Social Security is lumped in with Medicare and Medicaid as an entitlement program rather than general insurance.
And that is such an outrageous name. It sounds like somehow it's a government handout when you call it an entitlement. And the reality is that we've all earned our Social Security. People start paying Social Security on their very first paycheck sometimes when they're 13, 14, 15, 16 years old. So it is part of this attack of kind of trying to convince people that it's something that it's not. It's something, the reason it's, again, so popular is that it represents these important basic American values that we all share, which is part of the reason it's so popular. What's important is that the people who support Social Security become educated, understand, for example, that there's $2.7 trillion of reserves that are kept in trust for the American workers and their families, that they become educated, and then they make sure that politicians who, after all, work for the people, represent our interests and make sure that they expand, not cut, Social Security.
Mm-hmm. Now, I, too, am of the baby boomer generation, and I underlined the first lines in Chapter 2 and put 2 exclamation points beside it. Generations of Americans built our Social Security system, and they constructed it extremely well. Social Security has worked efficiently for nearly 80 years, never failing to meet its obligations, even during the deep recession that followed the near collapse of the economy in 2008. And if the public will is respected, it will be with us as long as there is a United States. That's pretty compelling.
It is, well, and I think we defend that. We believe that. It's also
true as well as believing
it's true. It's such a core institution. This country could not be the same without it. It has been built. The campaign. I don't want to suggest that everyone who opposes Social Security is a billionaire, first of all, because that's not true. Mm-hmm. But I don't want to suggest that. What we have is a billionaire-funded campaign, but we also have perhaps something equally or more concerning. We have the passive acceptance of language like entitlement, or of these ideas that it's unsustainable. We can't afford this system. That's been moved into the language into the culture of our discussion. Journalists have accepted it, many journalists, many politicians, even some Democrats who historically are very supportive of this system. It's become the wisdom of the time, and it's wrong. And that's the problem. It's not. It's been reinforced, and one of the reasons we write this book is that we want to put information out there that enables people to make the decisions for themselves, and also helps educate our policymakers. We also know the reason that Social Security has not been cut in the last few years, as many politicians were willing to do at various times, is because the voices of American people from Brownsville, from Madison, or from Akron, Ohio, or whatever, the voices of the American people started coming in to members of Congress telling them, look, we don't want you to cut Social Security. You may think it's obvious that this has to be done, but we know it shouldn't be done. And that's important. Our public needs to be engaged and let their members know that our Social Security system is not for sale to Wall Street. It's not for use as a chip in a grand bargain. It's ours, and it's our children's and grandchildren's. So one of the things Nancy and I say a lot is it's important to be engaged, to let members know, to follow what members are voting on, but also send that message. And we'd say take a look at our website of socialsecurityworks.org. There's some good information there. There's good information on a lot of websites, the Alliance for Retired Americans, the National Committee, many of the women's and disability groups, many good places to get information. Get it, use it, and hold our representatives accountable for both facts and also for what they support.
The book has appendices that look at the plans for how to resolve. Before we talk about expanding, I just want to emphasize one more time that retirement savings are poor substitutes for wage insurance, that there's an important difference there. You never know when you'll have extensive medical costs or long-term care needs, and that's a big one, long-term care needs. And it's also hard to predict how long you're going to live. So there's these uncertainties that you have to deal with, but wage insurance is the most effective way to protect workers and their families.
Absolutely. In a nutshell, you can outlive savings, but you cannot outlive Social Security. Mm-hmm. That is one of the beauties. And if you're married, your spouse won't outlive Social Security. So it's a family protection program, and it's built on these concepts so that it's universal, it's portable, you can take it from job to job. It's extremely efficient. It provides, its administrative costs are less than a penny on a dollar. You cannot find any other retirement arrangement that is as universal, as secure, as efficient, and as fair as Social Security.
And some of the most marginalized groups are better protected with this, the gays, lesbians, the minorities that have lower wage earnings and so forth.
Absolutely. It's a very creative and ingenious design, which is why it's so popular. It's extremely fair. You get the idea is that you get a fair return on your contributions, that the insurance premiums you pay, you get a fair benefit from it. But the understanding that those with lower income have less discretionary income than higher income people, it provides a larger proportionate amount for lower income. So you get a higher dollar amount the more you pay in, but you get proportionally more the lower. And the American people, it's a balance that I think the American people find very fair.
Mm-hmm. Your argument in the book is that now is the time to expand Social Security. Let's talk about that. What's the plan? How do we make sure that that works, and why now?
The now of it is that we have retirees and other beneficiaries who have minimal support. Ultimately, Social Security is important, but it's not adequate enough for a good majority of our beneficiaries. The why of it is also that we have a retirement income crisis, which we've discussed. We also have huge need to support families who are giving care to children and ill relatives, and also to workers who have to leave work when they're ill. And we have this extraordinary growth in inequality, which has helped create part of the financing problem. Going back to the 1940s to late 1970s, 2/3 of the income growth in our country went to the bottom 90%. From 1980 forward, all of the income growth went to the top 10%. Mm-hmm. That's a crisis, and that's where the resources have been going that can be used to build our roads, build our schools, expand our Social Security. And it's important to recapture some of that. We have a plan, but it's only one plan. There are many good ideas out there. Ours is not the only one, but we talk about how we can expand benefits by 10%, address the projected shortfall, develop a better cost of living adjustment, provide some family supports that aren't in there, provide opportunity for paid leave, and also improve a number of benefits, provide students, restore a benefit that used to exist for college students or people who are in advanced vocational education. The children of deceased and disabled and retired workers used to be able to go to college through age 22, up until age 22. Now they are only funded through age 18. Small change, but very important in terms of the people it affects. So these are things we can do, and we can pay for it.
We define expand in two ways. One is to increase the existing benefits. The retirement income, 2/3 of seniors rely on Social Security for half or more of their income. So it's very vital. And those, if you look at today's seniors, the majority are just one track away from being in poverty or already in poverty. So it's very important to increase the benefits of current seniors and those who follow. Tomorrow's seniors are going to be in worse shape given what's happened with home equity and wage stagnation and the shift from traditional pensions to 401ks and so forth. It's virtually disability insurance that it provides is essential. It's virtually the only, it's very rare benefit in the private sector to have disability insurance, and it's the most important life insurance that most Americans have. So one is to increase all those benefits across the board starting right away. In addition, though, we believe that Social Security is an institution that works very well, and we should expand the kind of benefits that are offered. So we propose paid maternity leave, paid sick leave. As the President said in the State of the Union, we're the only industrialized nation that does not provide that at the federal level. So that's a benefit. Children's allowances, that's another time when wages are at risk because parents do and should take time out for the workforce with a newborn. And so this would replace some of those wages. And yet we expand the benefits in all these ways, but we pay for them fully paid so that all benefits, existing benefits, and these expansions can be paid in full and on time through 2090 and beyond.
And so there needs to be more investment in this. And this was designed to be a floor through which no one would fall into poverty and distress. Who pays?
Absolutely, and I think we need to get to that question, which is the public has said they are willing to pay more for a more secure Social Security, but the public is also overwhelmingly in favor of lifting and eliminating the cap, meaning today millionaires and billionaires only make payroll contributions on earnings up to $118,500. Above that, nothing is paid. So effectively, someone like Bill Gates, by the end of his first day and probably the end of his first 10 minutes, has paid his Social Security for the year. Mm-hmm. But his secretaries and workers are paying it for the entire year. So lifting that cap in itself would address roughly 80% of the existing shortfall. Putting in a small 1% payroll increase in contributions gradually phased in over 20 years, so it only impacts worker benefits by an additional 50 cents a week each year. Mm-hmm. Putting that in would provide very significant resources for expansion. Taking the Social Security trust funds and diversifying them so that some portion of the trust funds are invested in private equities in a safe way, basically through an independent board in a gradual way, but a safe way, would also increase revenues and asking asking millionaires and billionaires, people who earn $1 million, to pay 10 cents on that million and first dollar and every dollar above that, and have that dedicated. Those things together provide very significant resources to pay for a projected program we project is sound for 75 years with this, and also benefit increases. But I want to say this real carefully. This isn't the only way to do it, and this isn't the only plan. There are many good ideas out there. What's lacking is imagination, empathy for our fellow citizens among some of the elites, imagination, and the political will. It's not about economics. We can afford it. It's about the politics and the distortion of our politics and the willingness of some of our political elites, some of our media leaders, the willingness to go along with the tide like lemmings and not question the conventional wisdom.
And we're going to have to leave it there. Unfortunately, we're out of time. We've been privileged to be talking with Nancy Altman and Eric Kingston. Their book, Social Security Works, is fast becoming an Amazon bestseller, and I recommend that you read it and that you look at the guidance that they're offering us, because Social Security affects us all. I'm your host, Dr. John Cook. I appreciate your listening. If you don't hear our program the 4 times a week it's broadcast, I remind you that we're also on YouTube at Good Books Radio, Strong and Cook, and you can hear a replay of it there. Thanks again for listening. Make it a great day.